And we can see our attendees are starting to come into the webinar.
Can they hear us now?
Yeah, they can. Everyone can hear you now.
Right. Go. I usually start a minute or two late just to, but let me know when it slows down, Robin. What do you think, Robin? Should we get going? What do you?
Yeah, I think you could go ahead. We're at 12:01, so I want to be respectful of everyone's time.
Okay. Well, welcome to our Advancing Authorship webinar. As we all know, the National Institute of Health issued the new NIH data management and sharing policy effective January 25th, replacing the previous 20-year-old policy. The new policy will require researchers submitting an NIH research application to also submit a plan outlining how scientific data from their research will be managed and shared, or, if applicable, statewide data sharing will not be possible. We thought the time was right to have a conversation with a panel of MSK staff from various departments that graciously agreed to share their recent experience or thoughts regarding the new policy. The panelists joining us today include Anthony Della Refugio, our Associate Librarian for Data Management. Anthony will be providing a brief overview of the policy and what the MSK Library is doing to support our NIH-funded researchers. Also joining us are Roy Cambria, Director, Human Research Protection Program, Dr. Kelly McConnell, Associate Attending Psychologist and Co-Director of the Psycho-Oncology of Aging and Cancer Research Laboratory in the Department of Psychiatry and Behavioral Sciences, and Joseph O, I got permission to use that, Senior Editor for the Department of Pediatrics. Each individual will be describing a bit of their role, and then they're going to share a little bit more about their recent experience in understanding or navigating the NIH data management and sharing policy. I plan to add a link to chat to our event announcement, which features our panelist bios, so you can dig into that later. And I also want to just encourage people, as you start thinking of questions, to kind of send them through chat or through our Q&A feature. But most of today's session will be devoted, we hope, to a very lively conversation that will be moderated by Robin O'Hanlon, our Associate Librarian for User Services. Finally, we really truly value your opinion and feedback, and we'll be sending a survey after today's session, and we really truly hope that you will give us some feedback. So let's get the conversation started, and that's going to be starting off with Anthony. So I'm just going to get out of share mode.
Great, thank you, Donna.
You got it?
Yes.
Thanks.
Let me, go ahead and start my slides. Oop. Okay, great. And thank you for the introduction. As Donna mentioned, my name is Anthony Dell'Orficio. I'm the Associate Librarian for Research Data Management here at MSK. So I want to talk a little bit about what we've been doing, what sort of projects we've been doing, services, tools, applications that we've brought up in support of this new data management policy. I'll talk a little bit about what the policy is as well. And when I say what we're doing, I mean what MSK is doing, what our library has been doing, and what we've been doing across different institutions with colleagues in a collegial sense. Librarians tend to work together to help solve problems. So we haven't been working alone in this arena, and I want to sort of talk a little bit about some of the progress that we've made on that as well. But first, a lot of my role in dealing with folks who are in the process of submitting grants, recently with the data management plan, has been very practical, and it's been, I have a grant due, and I want to get it finished. So rarely do I have a chance to talk about the sort of background and context and philosophy. So I want to take a moment to do that now. Maybe if you're at the point of submitting a grant in the future, you'll think back to this and go, oh yeah, there's a reason why we're doing this. This has a value that's more than just submitting forms or getting a grant completed, but this is actually part of a larger conversation and a larger plan that's happening within the industry and across the field of research. So I pulled a few numbers and made a few graphs. These are MSK submissions to MSK researcher submissions into public fair repositories. There's a lot of context for these, and I think more study would need to be done to pull apart exactly what they mean. But here on the top, for example, we have the Gene Expression Omnibus, which is genomics and CBI, NIH repository for genomics. And below we have one that's a little more generalist, big share deposits. I think what we can see without reading too much into the context of it is something that we would expect, something that reinforces an idea that many of us probably already had, which is that over time we are seeing increasing numbers of deposits in repositories. And the same is, same trend, same-ish trend we're finding with publications as well. So this is a graph of the percentage of publications by MSK authors in PubMed Central, which identify themselves as having associated data. And again, there's a lot of context to read into this, and I'm not trying to dig too deep into these numbers right here, but I think it does provide a little bit of a perspective on the role that research data has been playing over the past several years, and probably long before 2010 as well. This is not a new conversation. This is not a new topic. It's a new way that we're talking about it right now. A little bit of historical context as well. We started seeing maybe in the 20-teens more frequently articles that would come out to talk about reproducing science from the data that's cited in an article. And you'd see these sort of scary numbers here. This is one of the more popular papers on the topic, and one of the earlier ones that I could find, which says more than 70% of researchers have tried and failed to reproduce another scientist's experiments, and more than half have failed to reproduce their own experiments. And I think that those numbers are largely based on the data that's included. And again, there's a lot of context for that, and we could pull that apart, and people have been for quite a long time. There's a lot of reasons for that. Technical support has changed, repository availability has changed over time. People move around, and so the corresponding author is not always as able to follow up with data requests that happened before. But what happened out of this, what came out of this was the term reproducibility crisis. I think retrospectively looking at this, maybe we could have predicted this, and maybe crisis maybe was the wrong word. Maybe we now say this is just sort of in the broader context of research data management. This was a natural tendency. But research reproducibility crisis was the term that came out, and it prompted a lot of other thoughts. Here at MSK, for example, we've had researchers who've been involved in this conversation for much longer than this, contributing papers and different councils. A group of researchers got together in 2016, researchers and institutional representatives, and they had a conversation about how to address this reproducibility crisis and what could be done to set expectations for data, research data, how to change the direction that this was going. What came out of that meeting was an article in Scientific Data and a set of aspirational principles which all data would be striving towards, and those are the FAIR principles. That is that data would be discoverable, that it should be accessible as best as possible. We all know that that's a complicated conversation, especially in the context of medical research. Interoperable, we talk a lot about at MSK, we talk a lot about homogenization of data. And that we should support and promote data reuse where possible. I think that's something that is still being explored, what that means and what that value is. But those became sort of the principles that are now a standard, an industry standard, that we would all talk about and would grade things like repositories on whether they're FAIR compliant. Additionally, shortly after this, the FAIR principles were introduced, a group of an international group of data scientists and researchers from GIDA, the Global Indigenous Data Alliance, released another set of principles which are in parallel with the FAIR principles, and those are the CARE principles. They were largely gathered around Indigenous peoples' data gathering and usage. Those principles are that data should be gathered for the collective benefit of the people from whom it's gathered, that those people should have authority to control that data, that it should be gathered responsibly, and that it should be used with a sense of ethics on how it's used and reused. I think these principles are just as applicable, if not more applicable, in the medical context as they are anywhere else. So I would say at this point, I usually talk about them together. This is the principles that we strive towards when we talk about them, FAIR and CARE. I also want to talk about some other context for the data management and sharing policy. Some things that you may have seen come out that seem related and are in a broader context, but maybe not directly related to this policy. So the Nelson memo, which came out in August of 2022, this was a memo from the White House Office of Science and Technology Policy. It's not going to go into effect for a little while, but as we all learned very well from NIH's policy, 2025, not that far off. We should be thinking about this and talking about it in advance, as we did with NIH. This memo really talked about two specific areas. One had to do with eliminating embargoes. That's not really my area, but I have colleagues in our library who could speak very well to this. Perhaps more related was really strongly encouraging open data and sharing. So that was something else that came out that we see in the context of this. And we also see changes on the publication side where publishers are increasingly requiring data availability statements, as well as deposits of minimal viable data sets. This is terminology that we see from different publishers, and it's aligning in a way that I think in the context of funding, like NIH policies, we're seeing greater alignment across the industry. So it's just a thing to think about. I predict that this is going to be increasingly aligned over time, and we'll see greater parity across the entire research process. So what's in the new data management policy? Donna talked a little bit about this already. It went into effect on January 25th. January 25th was just a date, really. We've been talking about this for a lot longer, and we're going to continue to be talking about this and assessing what changes, what changes we can make and what adjustments NIH is going to make long beyond this. That January 25th date, however, came at sort of a key time, which is right before the R01 grants were due. New R01 grants were due in their early February cycle. So it's a date on a calendar, but it also did trigger a bunch of things for many different researchers and grant editors and offices within institutions. As Donna mentioned, the crux of this policy is that it would apply to any grant recipients of any award amount, dependent on the grant type, and would require that they submit a data management plan, and that data management plan has a little more structure and robustness to it than it did in previous iterations. It also said that there would be ongoing reviews and assessment throughout the life of a research project. That, I think, remains to be seen exactly how that's going to play out, because we don't have much information about that right now. While it doesn't explicitly require you to share data, it does strongly encourage it, or to identify when that would be inappropriate and why it would be inappropriate. So what's in a plan, right? So we're talking about this data management plan, and that's terminology that some people are familiar with because they've been doing this for a while. This was new terminology for other researchers who haven't had to do this before. Well, NIH they're asking for 6 key elements, essentially, that would be identified in a data management plan. They want you to think about what types of data you're producing, whether that is large like genomic data or REDCap form data. What are the forms of data that you might be producing as part of your research? What related applications or tools or code are needed to understand that data, to analyze it, to work with it? What types of data standards were used in the gathering and construction of the data? What your plans are with the data, where you're going to put it, how it could be accessible, what are the timelines for that? Is it accessible at the time of publication or completion of your grant award? Or are there other factors that play into that that would extend the timeline or how long you're going to keep it available? And then whether there are any kind of reuse considerations that need to be taken into consideration. I think when we talk in the next section, I suspect Roy will have some things to say about what kind of reuse we're concerned about. And then who's going to oversee this process and make sure that it's done. And I'm sure that that's a conversation that Joe and Kelly are going to have a lot to say about as well, as who's going to do this work and how are you going to incorporate that into the process of completing your grant. So let me talk a little bit about what the MSK library has been doing specifically for this, because as I said, this has been going on for quite a while, and we've been talking about it for quite a while. In fact, I've been here at MSK for about 3.5 years, and I seem to remember this coming up in my interview with Donna. So I think this is a conversation we've been having since the very beginning. And as we've been designing our research data management program within our library, this has certainly been in the forefront of how we've been planning to build a program here. So one of the first things I did when we started setting out to build this research data management program was to go out and listen to a lot of researchers. And we did a lot of investigation on what is the structure of research at MSK, what is the structure of research in general, and what are the needs of the users that we are going to be supporting. And I came up with this admittedly oversimplified research and publication process, but it became kind of a nice structure for us to build services and tools and applications around. And that's exactly what we did. We sort of took what we heard from our researchers and said, where are the pain points? What are things that we could do to make this a little bit easier? But the point that I'm making with this is that all of these things that we've brought up, we anticipated that many of them would very specifically support the NIH policy when it went into effect. So this was about resource management and planning in advance, that we would have things ready to go so that we could focus on other things when we got closer. And I'm not going to talk about all of these, but if you go to our library's website, you can read up on any of the little pieces that we've put into place. I'm going to focus on a few specific ones. Regarding the NIH data management and sharing policy, we had a specific plan in place that we went through. Obviously, one of the things that we do, and I think everybody does in their own way, is to network with colleagues. Libraries, I think we're particularly good at that. Promote my own field here. We work very closely with colleagues at NYU and Weill Cornell Medicine, Rockefeller, University of Pittsburgh, Northwell Health, and many other places, too many to list here for sure. And we work with different organizations collectively, like the Research Data Access and Preservation Group and Data Discovery Collaboration. These are places where we have these conversations among people who have similar concerns and are building similar tools. And there's a lot of sharing that goes on. We share knowledge, we share information, and we share the tools that we build, co-develop things. Also internal to MSK, we knew this would be something that is specific to our institution and to institutions in general. We started cultivating partnerships. One of the greatest partnerships that we've had since we started working through this was with RTM, Research Technology Management, now ORPA, Office of Research and Project Administration. I've worked very closely with Becky Castillo and Kelly Morrison's group. They've been wonderful to work with and connecting us with parts of our organization that honestly I haven't had much interaction with before. So these were some great partnerships, grants and contracts, compliance, and then also on to some of the more structural parts of our organization, like high performance computing, where we were talking about repository support. We've also done a lot of development. I think people don't always think about a library as being a code development shop, but that is part of what we do as well. And sometimes that means building tools from scratch. Our data policy finder, for example, is homegrown code that Eric Willoughby, one of our programmer analysts in the library, he and I worked very closely to design this and build this. That's now publicly available, and we're certainly looking to build partnerships outside of MSK to help keep these tools going. Our MSK data catalog is co-developed software. Originally, it's based on code that was originally developed at NYU Langone. We're now development partners on this project, along with University of Pittsburgh, University of Maryland, Baltimore, and many other institutions. And then broader applications like the DMP tool, which I'm going to talk about in just a second. DMP tool is a web-based tool, which is more broadly available, and we're part of, along with many hundred institutions, and part of that project. We also were identifying functional groups within our organization who may not be necessarily partners for us in providing support, but we want to provide access to information about specific questions that came up. So whether it's privacy or grants or budgets or compliance, we don't have all the answers, and our role as a library is not to interpret policy on behalf of MSK, but rather to connect people with the offices and programs that have specific knowledge in those areas. So there was a lot of information gathering that took place. And of course, communication, Purple was very helpful with that because they have direct lines to many of our researchers and grant editors. Donna and I also wrote quite a bit on blog posts and reached out to grant editors and PIs directly. One of the big pieces that came out of this was a resource, an MSK resource, which I think a lot of our colleagues have come up with similar resources at their institutions. This was a centralized hub where we'll be gathering information internal to MSK as well as external, and providing some guidance on how to approach data management and sharing policy for NIH, how to create a data management plan. And that's in the form of a LibGuide. LibGuide is software that is common in libraries, and that will be updated on a regular basis. And I'll show that in just a second as well. And then as the date of January 25th approached, we increasingly saw outreach through departmental presentations. I would say starting in maybe November of last year, we had an increasing number of departmental presentations, individual consultations, and sort of an unexpected service that sort of organically grew out of this was, if you're writing a data management plan and you're unsure of it, send it to us. We'll review it and provide feedback, and we'll help you understand what kind of information is appropriate. More than anything, all of this was designed around a basic tenet, which was don't panic, right? We've been through this before with other policies. We'll get through this, and we're going to work within our institution and outside of our institution to make this service easier for everyone to approach. We've also been thinking, and we're thinking beforehand about what's going to come afterward. FAQs, we've already been providing DOI support through DataSite. We intend to pick that up over time. Repository support, those are very closely linked. We'd like to launch some new classes as the new R01 grant submissions and other grant submission deadlines come up. We'd like to provide some other forms of support that might exist. All right, so I said I'd talk about the DMP tool. There's not much to say, except that this exists. If you're at MSK, you can go through MSK to get to it. If you're at another institution, your institution probably has an affiliation with the DMP tool, but even if it doesn't, you can still access the DMP tool. It's publicly accessible regardless of your institutional affiliation, and it provides templating and wizard style step-by-step create a data management plan, including with templates for the new NIH data management and sharing policy. The advantage of going through your organization is that we can provide specific guidance from our institution, internal guidance, as well as contacts to our appropriate folks to answer offices and people to answer questions that you may have. So that's and I think we have the link below, so you can check that out, dmptool.org. It's one link. I also want to just show you a little bit of our LibGuide that we put together. This is the resource that is regularly updated and is gathering information from across MSK, and also external sources related to generally the data management plans that are created. A lot of questions specifically come up about repository selection. That's been a common source of questions. Step-by-step instructions for accessing and using the DMP tool. Another common request from folks that I've spoken with was, do you have any samples? So we have a place where we're gathering sample data management plans, and also gathering from other organizations that have done fantastic work on that. I don't want to take all the credit for gathering sample DMPs. There's been some tremendous work done out there by other librarians. And then gathering some selected resources if you want to know more about how this process works. So if you just to wrap up a few key takeaways from this, and I would say also, even if you're not submitting a grant and you just want to be better with your data, make sure that you're getting the most out of your research data, getting the most out of its discovery and application of FAIR principles, you can always reach out to us. But specifically related to the NIH data management policy, verifying that your grant type requires a data management plan. If it does, then regardless of the award amount, you'll have to submit one. Thinking through what types of data you're going to be producing, that can be a healthy exercise regardless of grant types. We have these resources available, the LibGuide and sample data management plans to see what other people have done already. And the DMP tool itself, or the Word template version of that guidance is available. And finally, and I think I speak on behalf of all the librarians who may be on this call right now, please feel free to reach out to your library. We're here to help you. This is part of what we do. We're here to support your research. So, and if you're from another institution and you want to reach out to me anyway, I welcome that as well. So you don't have to be an MSK person to reach out to us, but certainly if you are an MSK researcher, feel free to contact us. We'll be happy to talk with you more about this. I actually like talking about this stuff. So please reach out to us. Okay, thank you all for your time. Let's move on to the next section of stuff.
Yeah, so Roy, if you could tell a little bit about what you do and how the policy kind of relates to you, any comments about navigating through the policy would be great.
Absolutely, sure. Thank you for having me. I'm Roy Cambria. I'm our director of our Human Research Protection Program at MSK. The HRPP office oversees the daily operations and helps support our institutional review board and privacy board. So our IRB that is charged with and is responsible for protecting the rights and welfare of human research participants in accordance with our federal regs and our internal SOPs. So our IRB is responsible for reviewing all human subjects research, whether it's retrospective or prospective. So we look at both. So these are prospective clinical trials that are actively getting consent or enrolling individuals, and then retrospective review, which could be secondary research use of existing data or existing specimens for secondary research purposes. So the IRB does have applications that review all this. We have several SOPs that speak to data sharing and the use of specimens and existing data. In order to prepare for the data sharing plan, new policy from the NIH, we looked at our existing resources and then we evaluated where could we improve or what else could we need to do to make it clearer for researchers on what is required for that.
Did Roy freeze? If you're experiencing the same thing as me, it looks like Roy is frozen. So I'm gonna hold off on Roy and maybe see how he can get back, and perhaps maybe turn it over to Kelly, Dr. McConnell, to talk a little bit about her role and her current experience with the NIH data management policy.
Sure. Thank you for having me. I'm a clinical psychologist by training and primarily a research role in the Department of Psychiatry and Behavioral Sciences, and submitted a data management plan with an R01 application last cycle. So the first cycle that this was a requirement. And like many of us, I think, was worried about the process and the extra burden it would have on the grant submission, which, as we all know, already includes a lot of documentation, but was able to work very closely with Anthony and the library staff to learn how to do it. And at least for the nature of the work that I do, which is focused primarily on patient-reported outcomes. So we assess distress and test behavioral intervention. So our primary outcomes are typically patient-reported. For that type of research, the process was fairly straightforward, quite frankly. And I know we're going to talk more about the data management planning tool, which I used in combination with the other library resources, actually found that we were able to put together a comprehensive plan that, from what we can tell, met NIH policy relatively easy with the resources that were available. So I'm happy to expand on any of those points, but that's at least the perspective that I'm bringing to this panel, which is as someone who did have to submit a plan as part of an R01 application.
With that in mind, let's go back to Roy so he could finish up.
Sorry about that. The
No
internet in
worries.
the office dropped of all places. So I don't know when it dropped or where, but just to continue, sort of the IRB oversees retrospective and prospective research, and our applications speak to how is data managed, how's it being shared. And what we did to look at in preparation for the policy, to look at the templates and see what else needed to be articulated in those applications. The IRB doesn't see the grants, so we really need to know about the data sharing process and plan via the protocol. So our investigator initiated trial templates and our retrospective and biospecimen research protocol templates were updated to really ask the PIs and investigators to articulate what they put into the grant regarding data sharing. In addition, for prospective consent, we had privacy language to speak to sharing already. The required regulatory elements of consent, what like standard language that needs to be in there, actually speaks to future data sharing in a de-identified way. So that's already language that's been going into our consent forms since 2020. And that really articulates to the participant that their data may be used in the future for reasons beyond just what's articulated in the consent form. In addition, we're looking at the privacy data sharing language and continuing to build upon it. Our current policies are, we have two. One is specific to genomic data sharing, and this really outlines the NIH policy for genomic data sharing and what's still required, which still holds play here. And any use of genomic data that's derived from samples or existing data really has to follow that policy in our internal SOPs. So the IRB already evaluates and approves NIH data certifications. Our institutional official signs off on those, really attesting that the data and samples were collected according to the federal regulations, according to the NIH genomic data sharing policy. So we do have an internal SOP for that. We launched a new SOP in January, really speaking about use of samples and data in a prospective and in retrospective way, and that's available for our researchers, and it touches a little bit on what's required from a consent perspective. And I think that's where some of these questions may start coming up in a retrospective fashion. We have samples in the bank, or we want to use existing data. How do we address this data sharing policy from the NIH? And part of it is really going back and looking at what the consent told participants that we were going to use it for. And evaluating that. So I expect more phone calls to the IRB office and more inquiries about this, and we're happy to connect with anyone and really speak to what is and what can be allowed and what can't be.
Thanks, Roy. And Joe, would you like to kind of share your thoughts, your role, and then how you're at navigating or encouraging people to navigate through the NIH policy?
Sure, no problem. My name is Joel Ognovich. I'm the senior editor for the Department of Pediatrics. My editorial experience is probably maybe slightly different than many other editors that might be on the call. I see a couple already in the comments. And that is that I started and was brought on in a role in the clinical research office in pediatrics, assisting with protocol documents, writing informed consents before all of this was somewhat centralized, and other supporting materials for that, in addition to helping out with grants and public scientific publications. So my experience with the data sharing and management plan requirements by the NIH, these new requirements, is that we had an R01 deadline in February. I assisted one of my PIs. I don't know if this is other editors' experiences, but I tend to write things that nobody else wants to write, at least in draft form, before they're polished up and made fuller by the PI and their expertise. So I assisted with that to some extent. We investigated some of the variables involved in writing these DSMP to a limited extent, looking at different database options, looking at what data was actually required to be shared. I've also had experience with data sharing through publications, right? So as Anthony touched on briefly, journals and publishers have been requiring, I'm sorry, I take that back, not requiring, but suggesting, some have been requiring data sharing. It depends on the field to some extent. And we have to accommodate those requirements as well. So it's tricky, especially when you're dealing, and I'm glad Roy's here, when you're dealing with clinical research and retrospective data. That's, as I think you'll see when we go on and go through more questions, that's one of my fears, or the biggest difficulties I foresee with this policy is being able to account for that sort of thing, and proprietary data. Whether you signed a data use agreement with somebody else 20 years ago, and having all these things impinge upon what you're telling the NIH, a government agency. It's a little. I'm not panicking, Anthony, but it strikes a little. I'm a nervous person by nature, so that's that's something I worry about. Let me see if there's anything else I wanted to say. I think that's good for now.
Well, with that in mind, and kind of level setting this conversation, our moderator, Robin, is going to start with some of the questions and some of the questions from the audience. So take it away, Robin.
Thanks, Donna. I think I'll start with our questions from the audience, so we're sure to get to them. And again, like, we would encourage you to put your questions in the chat or the Q&A. So let's see, we have two open here. Let's see, do you have any templates specific to evidence synthesis, like systematic reviews or scoping reviews? And Vanessa, go ahead.
Sorry, I'll take that one. We don't have any templates that are specific to any particular type of research. The templates that we have are for a data management plan are a little broader than that. It's really based on what type of data you're gathering or what types of data you're gathering, and they probably don't make too much of a difference between the different types of ultimate research output that you're planning on doing or research methodologies that you're planning on applying. But Robin, you may actually have something to say about systematic reviews and that process, because we do provide support for those specifically within the library as well, but that is not specific to data management.
Yes, yeah, we have a systematic review service that's within the library, but yeah, not specific to data management. The other question was just about sharing the slides will be shared, provided to you. Okay, so we're gonna hop into some of our questions, which I think will generate some great discussion.
Actually, just one quick plug. I put it into the
oh yeah, thank you.
Their NIH maintains a number of sample documents. Maybe you can one that I'm unfortunately ignorant of what either scoping. I know what a systematic review is. Yeah. I haven't heard the term scoping review. I'm sorry, I apologize.
Just a different type of review. Okay.
Yeah. But you might look at that. I would say also, if you're not generating new data, you can't commit to sharing other people's data. I think there would be pretty minimal in terms of the systematic review, but again, there are so many variables. It's hard to say without sitting down and looking at it for a couple hours.
Thanks, Joe.
Sure.
So I'm gonna start with, oh, thanks, Stacy. Hi, Stacy. Stacy just entered, looks like data management plans for systematic reviews, a LibGuide from University of Calgary. So that is fantastic. Thank you, Stacy. Okay, so what do you see as the greatest challenge for this NIH policy? Are the hurdles you have experienced? What are the hurdles you've experienced or expect to experience? And Joe, thank you for saying that you're a nervous person by nature. I think, sharing that, I think there definitely is some feelings of anxiety surrounding this. So I think it's great to acknowledge that. So yeah, what do you see as the greatest challenges with the policy, the hurdles that you have experienced or expect to experience, and issues within your field that could be particularly problematic? And I believe the floor is open, so just feel free to jump in.
I think I already voiced my major concern is privacy concerns, right? And what the NIH is going to say, oh yeah, that's fine, you don't have to share that, or what the ultimate form of this policy is going to look like. The ultimate form of complying with this policy is going to look like for patient related data. That's my personal concern. This is far afield, but my concern about just putting data out there for the public is I think you're going to end up with some problems. I don't know how well the NIH and the government have thought this through. And it's I worry, you could get generative bad studies, right, of data that's out there existing. People don't understand correlation versus causation, as we've seen from the pandemic. And it's probably my number one or two. That and anecdote are my number one and number two criticisms of society. Your willingness to believe anecdote. So that's not relevant. Sorry, but it's a concern.
Kelly or Roy, did you have anything you wanted to add there?
I definitely want to second what Joe just said about just the challenges of interpreting data and the implications for that. And I think about, it's always a balance, right? So I think about wanting to be transparent, wanting any work that we do to reach the public through the media, for example. But if there isn't an expert to help translate what the numbers are saying to the public. And again, this is what Joe is saying, right? We see how easy it is for people to, especially if there's a headline, to really misrepresent the data. And so, what are going to be the implications for that if the expert is removed at any point in the process? I think as a researcher, right, who is in a space where I'm evaluated by things like number of publications, ability to bring in additional grants. And as someone who is also, I hope, collaborative and really wanting to work with other people within my institution, but across the field, again, it's a balance. I think there is some worry about being scooped, right? Putting all the time and effort that starts when you conceptualize an idea through getting a grant and, making your data public. And then the implications of that for any individual research or research team in terms of advancement and just the things we have to do to keep our research going, right? And so again, it's not that I'm against the sharing, right? Because there's benefits to transparency, but just again, feeling that tension around who owns what and who gets to benefit from the effort that individual or research teams have put into collecting a data set, which can be years and years and years of time and resource. So yeah, I don't have an answer, but that's certainly a concern that has come to mind.
Kelly, I have a good analogy, right? So, it's when you're a researcher and this policy it is thrust upon you're running a marathon, right? As a PI, as an investigator, and this policy is someone throwing you a Rubik's Cube, right? And you're now you've got to do that while running the marathon that other people may be racing by, right? So that's what pops into my mind with what you just described.
Yeah, and I think maybe Roy mentioned this, but I was putting in an R01 in the February cycle 1, and this was something that just had to be done, right? If we were going to submit the grant, this had to be done, right? And so as a researcher sort of coming into this very late in the game relative to people like Anthony and our library colleagues, it's sort of, you put it well, we have no choice, right? If we want this grant to go in, we're doing this. So I think that can feel uncomfortable for people. I was comforted after speaking with Anthony and the library staff that people who are much more well-versed in these kinds of things had been thinking about this for many years. I did take comfort in that. But I think from my perspective, it was like, well, this is another document. We have to do it right. We have to get it in. And it almost felt like the long-term consequences that we're talking about now, just that can had to be kicked down the road. And so I'm just hoping that some of these implications will be thought through before we get there. I'm going to be optimistic about that.
Great.
I would echo what they said, but also, and thinking about that because it's so early that you have to write this data sharing plan, right? It's early in the process, and it's before you've even sort of conceptualized and like put down on paper like a protocol and how you're going to recruit participants and so forth. So it is much earlier in the review process, and really making sure that all of the things that need to be thought through, the trickle down, is thought through earlier on, right? And that hasn't been the case in the past. And I think that's a mindset that has to be changed a little bit with our researchers. They have to think about that and what that means down the road. And the whole consent piece is something that's important, right? Making sure like the research participants in whom we're collecting data from are understanding that this can be shared and what that means and who may have access and what's going to be collected and particularly around genomics. I mean, there's a lot of sensitivity around that, and it needs to be clear. And I mean, the NIH genomic data sharing policy speaks about controlled access and open access. I mean, we've taken the approach for certain type of genomic work, it has to be controlled, and that's what's been in our biobanking consent since 2006. I mean, that's sort of the language that's been in there. And that again goes back to the protection of human subjects and the appropriateness.
Yeah. I even in my work where we don't have genomic data, it's patient report. When we get to that section of the consent form where we talk about the risks of loss of confidentiality, or patients do often ask about that, rightfully so, right? Rightfully so, and so that is already something that is on their radar, that they ask for follow-up on, and so. And that's in very low risk studies, right? And so I can imagine that's going to that's going to just elevate that even more once we add this kind of language.
And Kelly, you have probably things like free response fields, right? How do we share that? I don't know. Did you know?
So
that's too private or something, right? That's an exemption. We won't share free response fields or something like that.
To be honest, we didn't delve that deeply. It's a good question. I think where the point at which we took it was, does the repository that we are selecting for our data management plan, can it handle those kinds of responses? That was sort of as far as we got, to be honest. So it's a good question. I don't know if some of those things would be more exempt. You think about different topics too, right? If you're asking about more sensitive issues, risky behaviors, for example, and you have those sorts of questions, sort of how do we think about that? Information that people are already more hesitant to share, again, understandably, might feel like a bigger risk.
Yeah, I mean, I've heard a lot of these concerns from different researchers who I've conversed with, whether it's a concern that they think their patients are going to have, or conversations that they're going to have, or being scooped. These are all, I think, on the forefront of a lot of people's minds as they go through this. One of my concerns is whether that sort of anxiety, there's a value to panicking a little bit, to say, we need to think about this sort of carefully, controlled amount of panic. And it's hard to know what is the appropriate place, the appropriate amount of concern to put on this. I actually agree with you. I'm a little bit of a panicky person by my nature, but I try not to let that. In this particular role, we're trying to alleviate some of that concern. One of the fears that I have then is that researchers would back off of certain types of research because they don't want to engage with this process. And this shouldn't be driving the research. This should be something that is actually there to help enhance the process. But if this becomes a sticking point for getting your grant or just getting a paper filled out, I think there's a potential headbutting between the spirit of the law and the letter of the law. That is not the intention, right? I mean, you're making decisions. I think you've all mentioned, Roy specifically mentioned, how early this is in the process. And we all know that by the time you're ready to publish your data, technology will have moved on. There may be new repositories. Maybe your field doesn't have a specific repository right now, but by the time you are ready to publish, you want your data someplace else. What are the mechanisms for doing that? And trying to remember that there's a lot of this is geared towards behavioral change in a laboratory. And those are some of the hardest things to do, is to sort of change that, like that reproducibility crisis. Some of that was based on behavioral problems in a laboratory, not nefarious necessarily, but just sort of, this is how we do things. And young scientists learn from senior scientists how to do things. So trying to make these kinds of changes can be difficult under any circumstances. This policy, I think, is hoping to make that a little easier and more transparent, but could have the potential of just being a series of check boxes that you have to complete, and that's not what we want either.
Thank you for all your responses. So now we're getting some great questions in the chat and the Q&A. Thank you to everyone. I'm just going to choose at random. Thank you to everyone. Been thinking about this topic. This is from Megan Woods. Hi, Megan. Been thinking about this topic since the NIH asked for policy change comments greater than over, this isn't math class, over 3 years ago. Appreciate the multidisciplinary team effort as the IRB reviews and protocol after the grant has already been funded. We've had challenges in the past with quickly changing policies, NIH, MSK, institutional, where the research team have had to readjust our deliverables that add time, effort, cost, and sometimes conflict with NIH. With all the tools, guides available now, what is the mechanism to help the research team have their data sharing plan / promises vetted by IRB before grant submission?
So that's a great question, Meg. And some of the historical and going back to like that retrospective review and that retrospective work has definitely been challenging as genomic data sharing policies changed over time with the NIH, and which affected our institutional policies and our templates and so forth. I think if you have questions about when you're writing your grants about the data sharing that isn't answered in our current SOPs, then always feel free to reach out to me or anybody in the office to talk through and have a consultation. So we're happy to do that.
I can follow up on that real quick. I just had a quick question, and this is maybe a question for Roy. Could we envision people who are submitting grants, submitting their DSMP plan that involves any NIH supported IRB approved study, and checking that that is compliant? Or would that would sort of be a administrative burden that you might want to take on?
And that's a lot of, yes, since the grants that are submitted, there's only one of me.
Yeah.
But I think again, and again, we haven't really interacted with this yet, right? So as we're seeing things come up, this is the time to be actively talking about it and seeing what other resources we need to put together or any change in policy or templates need to be done to help facilitate the review and help our researchers stay compliant with our own internal policies and be aligned with what the NIH is expecting.
Great. So Roy, we have kind of another question for you from Catherine. You mentioned earlier in your introduction that the IRB office updated the templates for IITs, RRPs, and BRPs. It also sounds like the ICF template is already pretty robust in terms of including data use and sharing language. However, will we be required to amend any active protocol, i.e. IITs, to update any information, particularly if this new NIH policy affects grant renewals?
If you have to put one in for the renewal, you should amend the protocol to speak to it.
I feel like the answer is always err on the side of amending the protocol. So Anthony, I'm going to kind of have two library questions for you. So one is, does the library help with data standards in developing DMS plans? And how will the library support the RDM in repository selection, if at all?
Yeah, good questions. The standards, yes, we will work with any researcher to talk through what are the processes. I think one of the things that we've that have become conflated, that I've seen frequently conflated in research data management plans that have come across my desk, is the crossover from sort of methodology of research processes with the data production process. They see that they're very closely linked, of course, and we see a lot of like the human subject or intervention by IRB and what role that plays in data. But for the data management plan specifically, that part is maybe left elsewhere in the grant process, and it's more about the data that's already presumably whatever data you're producing is already a part of the production process. So in terms of data standards, yeah, I mean, we have some knowledge about that. We have knowledge of metadata to go with, to accompany data. That would be something that I think libraries are, depending on staffing resources, are able to help with. As with any question that comes to us, if we don't know the answer, we're going to find people who do have better expertise in it. That's sort of a standard library answer to questions, is, we may not know all the answers to every question you ask, but we'll go out and help find answers. So if we don't understand the standards that you're specifically using to gather your data, we'll help you do the research to figure out what that is and connect you with people. And then we incorporate that into our FAQs and we incorporate that into our resources so that can be reapplied. As far as repository support, I think that's probably one of the most frequent questions that we've been getting. And Donna and I have a plan. We've been talking with some folks. We're trying to figure out how to do this best. Repositories, and my background, I guess I should mention, is in sort of library technologies, and I have in previous positions supported repositories, supported storage area networks from a very sort of technical perspective. And they're incredibly complex and expensive physical hardware to maintain and to promise that you can back it up and make it available and accessible ongoing. So it's not something that you would want to just sort of casually agree to or agree to support. And in fact, we have tremendous resources here at MSK and external resources as well. So certainly in repository selection, we're able to help with that. I think we can do even more going forward. And certainly this round of R01s that we went through and a few other grant types that we've also had conversations with have sparked some conversations that we'd like to be having about where is the best place for that repository support to go. How does that apply to the publication repository support, which I think is also really important. We have other motives as well, like our data management, our MSK data policy, data catalog. We want to be capturing information about research output at MSK, and so having some knowledge of where data is being deposited would help streamline that process and those workflows. So I guess the answer to that is we are supporting them right now through mostly public means. I think Kelly, for your grant, you chose the Harvard Dataverse, which is free, public, fair, compliant repository, and that's cool. But I would like to see in the future, I'd like to see some better options and some more specific options from MSK, and we're going to work on that and partner with folks to come up with some better possible options, as well as the metadata support that would, help us do more to make data discoverable and not expose anybody's research to being scooped or anybody's data to being, PHI non-compliant. But yeah, it's a good question and a good conversation. Something that's ongoing.
I would add that we typically for genomic data, you need to be using dbGaP for the depositing that type of data. And then internally, we're clinical research IT group is working on building a repository for both storage and sharing internally as an alternative for our MSK researchers. So they're actively working on that, and we'll be sharing resources soon.
So we have a sort of a genomic data question. The PI defines the time frame for data sharing. We have participated in a number of genomic initiatives through NIH, and they always afforded us private access for 2 years before it entered the public space. As PI of the sharing plan, can you keep the data private for 2 to 3 years?
So one of the things that you define in the data management plan is what your timeline is. NIH, their guidance from the data management policy is that your data be shareable by the time of publication. So it doesn't, they're not asking at this point that you make your data be live available as you're gathering it. That's not really the expectation, and I don't see that as being valuable enough, considering the risks that would incur to being ever really a part of the research process. I don't know about 2 to 3 years. I guess that would depend on the grant, the amount and the timeline of the proposal. But the wording that they have right now in the policy says by the end of the grant period or publication, I think whichever comes first, I think is their wording. But there is room to define when there would be an exception to that as well. And part of this policy is also that there's some kind of an ongoing assessment with your NIH liaison. I think I'm hoping, and I don't know, Joe, you may end up having more conversations with NIH than I do, but I'm hoping that conversation is a fluid one. That's something that we have not encountered yet because we haven't gotten that far into this process. But I hope that this is something that is more of a conversation with them than an adherence to a policy.
I do remember, I know there's something on the FAQ page about certain exceptions for holding data longer. And I can't remember if this particular example is covered. Interestingly, SBIR, STTR grants, where you partner with industry, you're permitted to hold that data for 20 years before making it public. So
No, look at that.
start a SBIR grant and you don't have to worry about this at all. Just found a company, have them partner with you on the research.
So we have a question that was said just directly to the host and the panelists. So in 2011, the National Science Foundation implemented the same requirements for their grants. Has anyone looked to this for lessons learned? Where are they now, et cetera?
I have zero experience with NSF grants. I know they exist. And I didn't know that they had this requirement already. That's interesting to me because I'm gonna look this up. That's my best.
Yeah, I admit that I don't have a great response to that either, and thank you for that question, because I've got some more work to do, some things to look up. I'm hoping that because of the relations. See, this is the value that I thought, and why I talked a little bit about the value of networking. We'll never be able to cover all the cases. I'm just one person, we're just one library, but collectively, if we sort of work together, and I would say librarians are pretty good at that, I'm hoping that this is something that other people have looked into already, and I'm definitely going to go do some research now as well.
Great, thank you. And the attendee just shared a link with us about the NIH versus the NSF, the differences between the proposal submissions. And anonymous attendee, if you like, we could share that with the group, but you could let me know if that's okay with you. So I have two kind of budget questions that I think I'll combine. One is, this is a very interesting question. How do you determine the cost of maintaining a data set? So I'll let you all answer that one first.
Just real quick, I know some of the recommended NIH depositories that do charge provide pricing plans. Some are free. Kelly.
Yeah, that's absolutely right, Joe. Some of them are free, and some of them, like Dryad, have a specific amount that's related to deposits. I think Dryad is in the $150 range per submission. Other repositories have. So this is treating a repository like software as service, right? This is something where you're paying almost like a third party to maintain the hardware, maintain the backups, maintain the integrity and the accessibility of that data. And sometimes it's worth that, like as a license or as a cost, a one-time cost, or an in perpetuity type cost. That's a dangerous word, in perpetuity. But those are sort of things that you kind of expect when you submit. A lot of those repositories can have institutional affiliations assigned to them, so it becomes almost like a subscription for the institution. What makes me a little bit worried about some of those is the long-term availability of that. What if you chose not to continue with them? Or I guess that's a problem for down the road. Other repositories have quite a bit. Some very expensive. I don't know if Joe, this is somebody that you were working with. One of the researchers that you were working with was the Vivly conversation, that's about $4,000 for submitting for a project. But there are additional costs related to de-identification and anonymization, which is a huge conversation as well. I think that was like $10,000 additional for that kind of submission. So you do have to do some of this research. And then, as we said, it's earlier in the process than we were used to. So you're thinking about things before you even have money in hand. So, it is hard to think through the long term. How much should I be asking for this? If you're going to do it in-house as part of your institution, then it falls under some other sort of funny-ish categories where is that part of the overhead of your institution, in which case you may not be able to claim additional money in the grant for it. That may not be part of your budget. But if your institution is willing to maintain it, you certainly want to make sure that you understand what the long-term ramifications are for your institution. If you're going to assign DOIs, for example, you're kind of committing yourself to someone's going to be a data steward for this going forward. This is something that we're kind of promising to do, is to take care of the data over a long-term period. So it's a tough question to answer how you would budget for that. there are different things you could budget for, and there are allowances within this policy for certain types of data activities like data massaging or metadata application. You could be, I guess, kind of paying someone to take care of some of that. I'm not sure how exactly that would work. Joe, you look like you have something to say.
Yeah, no, I just wanted to note a good resource for this is your grants manager. They're going to see many of these applications and see what people are budgeting for
Yeah.
and maybe have some options to show you things like that. But our wonderful data grants managers are resources for that.
Yeah, they would be able to answer a lot of those questions. We do have sort of a comparison chart on our LibGuide of different generalist repositories. NIH has some good lists of repositories that are available. Some of them are completely free of cost. If you're, if you're managing a smaller size grant, I think this was, Kelly, when you and I spoke, this was one of the things that you were considering was, are there any free options, and is it really free, or is it free, free as in puppies, not free as in beer, kind of like, or is this going to be something that we have to contribute staff resources to maintaining, or is it truly free where we're just depositing data somewhere and have an expectation that it's going to meet fair compliance?
Yeah, and I like I said before, the types of data that I collect maybe are a bit less complicated than what other researchers might be collecting when it comes to data sharing. But the way that we handled it, and again, to your point of we were doing this for the first time with really not yet an understanding of what downstream implications might be, is that we chose a repository that Anthony helped us identify that was, endorse might not be the right word, but sort of approved by the NIH's meeting requirements. And then we budgeted staff time on the grant to support the data cleaning and de-identification and those sorts of things that will need to happen to put the data in that repository. It was a educated guess in terms of the amount of time that would be required, and I think that's just sort of a learning curve, but that's sort of how we handled it for this initial submission. I think we were making our best educated guess based on the information that we had. So I don't know if that's the best way or the correct way. I think we were compliant with the policy, and it just sort of remains to be seen how that plays out if we actually get the grant and run the study.
Yeah, I think it's a hard thing to determine for sure. Especially if you're part of a really large grant, multi-institutional type grant, it's maybe a little bit easier to predict you're going to hire a person to do a particular task. When you're in maybe a smaller setting, you're trying to think what percentage of someone's time is going to go towards a thing. And I think it's also important to remember and to note that from the data management from the data management plan perspective, budget is not actually included in the data management plan. It's included elsewhere in the grant application, and that's where you would indicate what kind of line items in terms of time you're spending on data management. But the data management plan itself doesn't really mention budget specifically.
And just for folks who are curious about that, we were told that we had to have a line item budget for this in the budget, which got a little bit confusing since we were using this strategy of building it into our statistician and kind of data management position. So I don't know if this is correct, but we were told to just have a line item budget that had $0 and then refer to the description in the budget justification and make sure that explicitly stated that this person would be managing the data management tasks. So again, I think we'll probably learn better ways of doing this, but at least that we sort of could check the box of having a line item, even though we weren't having dollars associated with it, and just making clear where that was falling in the budget. Obviously, that'll be different for folks who are paying for a repository and those sorts of things that would fall in that line item, but we still had to have the line item.
You know, I imagine it's weird. The study section isn't going to see your DSMP plan, your DSM plan, but they will see the budget, right? So,
Right.
so this maybe the study section is supposed to just judge if you think if they think you have enough money committed to what they think you're going to do with. It's weird.
Right, when nobody knows how much money that actually is.
Well, I imagine in the future, the NIH is going to say, oh, now this is part of review, right? They're just doing it now, not making it part of review because it's the first time.
Yeah, it's I think, Joe, I think you actually said in a pre-conversation that we were having before this meeting that the cart before the horse sort of analogy, and it does feel like it's sort of maybe a different analogy, chicken and an egg kind of thing. How do you get there from here when you need to know certain things? This is not part of the grading of the grant, right? And this is not part of the scoring, but because how could it be? But it's going to follow if you do get the money. So how to know what is the right order to do these things and how to think about things in the right order is.
Well, yeah, and not only that, I think my earlier comment was related to, sometimes you don't do exactly what your grant says you're going to do, or you find some new variable you need to collect. It's. I think we should all just realize that these things are changeable. Your program officer hopefully will have sympathy for things that happen along the way.
And I think in line with the spirit of the law here, I mean, the spirit of this policy is that you're thinking about this at an earlier stage in your research, and you're having these conversations. If I were to hope that something were to come out of this specific, it would be that the communication lines become a little bit more solid within our institutions and between institutions and funders, that maybe we didn't think too much about where data went before, but maybe that's now something that you're going to think about as part of your research process, that as a grant editor, maybe you have a little bit more conversation with the PIs about exactly what they're planning on doing, and that somehow that translates into a stronger structure within your organization.
Yeah, and there's just like two comments in the chat that are germane to this. So one is if you don't have any line items, you still need to address why you're not requesting the cost from James. And then we had Martha comments that she was told by a PO that they're expected to see budget entries for archiving costs if you anticipate having them, but you before you anticipate posting the data, so you could have costs to set up the archiving in the first year or whatever year might be appropriate. Okay, so I'm just going to go through and make sure that I didn't, that we're capturing all the questions we have. So another question Martha had earlier in the chat was, are you aware of any issues related to DMSP files budgets that may be experienced in the submission process for the applications? We might have actually covered that in our discussion just now. I'm looking at, thank you for sharing. So the NIH has a good FAQ about budgets and shared a link in the chat. That's great. And then I'm just going to look in the Q&A. This is a follow-up, Anthony, for you about the public repository information. So assuming the other support to select the data sets that can be deposited into the public repository could be the following concern. And I think we have kind of talked about that, but if you want to add anything else there.
So there's a few ways of thinking about repositories, I suppose. There's sort of the public repository versus your internal repositories and what you would have. And then there's also discipline specific versus generalist type repositories. I think Roy mentioned dbGaP. I mean, there are certain disciplines that are pretty good about and have for a long time. They're predictable, I would say, which disciplines have like a really good handle on a specific type of data that they know they produce as part of their discipline, and they have all kinds of tools that are integrated to handle that data. dbGaP is just one example. The GEO, the Gene Expression Omnibus, has all kinds of integrated tools. So for some people, you would gravitate towards one for those reasons, and cost may or may not have anything to do with its grading as a discipline specific or a generalist repository, or on whether it's sort of internal versus external. They could all they're all a little bit different. So you do kind of have to think about these things on an individual level.
Great. So I think those are all the questions that we've had from the audience. If anyone has any last minute burning questions, they can enter them in the chat now. But since we're sort of approaching the half-hour mark, I think what I will do now is turn it back to our illustrious leader, Donna Gibson of the library, just to wrap things up.
I don't know about that, but thank you very much, Robin. I just wanted to thank everyone for sharing their honest thoughts about where the policy might take them, how they're going to navigate it, things to think about as you start to deal with it. I truly appreciated this conversation. And in many ways, we probably have more questions, right? So maybe there'll be a take two at some point down the road. And I hope that my colleagues and staff and folks who agreed to participate this time around might want to consider it again and maybe encourage other people to join. I just want to thank everyone. Again, I'm going to remind people that we do have a survey. If you can complete the survey, that would be awesome. It helps gauge us. And if there's thoughts or ideas for scholarly topics you want us to have moving forward, we truly, truly appreciate it. So with that said, Roy, Joe, Kelly, and of course, Anthony, thank you so much for sharing your thoughts. Robin, as always, you are the consummate MC and moderator. And I just want to wish everyone a wonderful afternoon.
Thank you.
Thank you so much.
Thanks all. Have a good afternoon.
Thank you.
Mm-hmm.